The new DHHS rule requires applicants for Temporary Assistance for Needy Families, or TANF, to get drug tested if they've been convicted of a drug-related felony within the last 20 years. If the test comes back positive, the recipient either has to enroll in a substance abuse program or benefits will be cut off.
The United Kingdom is fed up with those people who use government benefits as their private money-making play toy, deciding those who are convicted of benefit fraud can now face up to 10 years in prison. Of course, there are those who decry this as nothing more than a sham to go after people who are in desperate need of help. But it's an idea whose time, according to some, may come here in the States. Our next guest is the Executive Director for CLAAD, the Center for Lawful Access and Abuse Deterrence. Michael Barnes joins us. Michael, thank you so much for being here today.
My pleasure. Thank you.
Michael, this gets started when Scott Walker said that he is formally proposing drug testing for people who want unemployment benefits. This sat with a lot of people very uncomfortably, but I got to tell you, and I'm sure you know this, there's a lot of folks out there saying there's millions of dollars that are being wasted here. What's wrong with this idea?
Well, actually, I think that if we look at the idea and analyze it, what's wrong is that we're looking at the cost savings from the perspective of the benefit programs. But actually, the much greater cost savings for government exist where you can get people into treatment for substance use disorders and then save money on healthcare costs, on crime, and related productivity costs. So if it's done right and people are drug tested and then referred to effective treatment so they can get their lives back and return to work, then you can have a much greater opportunity for savings, because we see that there are over $560 billion worth of costs related to drug use per year. That tapping into that level of savings is the best way to think of programs of this nature.
Okay, now let's bring people up to speed, because until 2012, federal law barred states from using a drug test as a condition of eligibility for unemployment insurance. But that year, Congress changed the law, saying that if you worked at certain occupations where drug testing was common, then yes, it's up to the U.S. Department of Labor to decide which one fits that bill and then go ahead and do that. Okay. All that. The president says he simply will not allow Scott Walker to go where he's going on this. Why then are we not then moving towards your suggestion? Because it sounds logical, and if it saves money, who's in the way?
I think really it's a matter of structuring the program, and probably more importantly, the messaging, to make it clear, as Scott Walker already has, but probably not well enough, that programs of this nature are not to cut people off and send them back to the streets. His program actually proposed to send people to treatment and direct them to social services so they can get back on their feet, get well, and become productive again. And that's consistent with the way that our unemployment system already works, where people are encouraged by the system to apply for jobs, to do what it takes to get back to a productive way of living. This is consistent with that. It's just a matter of, I think, making sure that it is not deemed or not perceived to be a punitive program that just sends people off to the streets.
But then isn't it fair to say that what we're talking about here is, even Walker himself and others have said, this is not about stopping people from getting benefits, but you do have those on the other side of the argument who said they see Republican and they immediately them seeing trying to harm people and be punitive against people who simply need help. That's not what this is about. It's being overstated, isn't it?
That is not what this is about. This is about the acknowledgement that there must be a safety net, and there is a safety net. And the opponents of programs of this nature are trying to say that, oh, this is an effort to cut a hole in the safety net for people who have substance use disorders. It's not. It's actually providing an extra layer of assistance for them so that they can, in addition to getting the benefits, they can get the treatment and the resources necessary in order to get a job and become productive and become healthy and well. So again, I do think this is a matter of appropriate structuring of the program so that its therapeutic purposes are definitely at the forefront. Cost savings is very important, but that's not as strong a driver of a message. And then messaging generally, of course, must be also updated to reflect the truth of the program.
Michael, isn't that the single biggest thing that we need to focus on here? That a lot of times when it comes to people who desperately need help and they're looking to get back on their feet, they want to do something actually productive again, that the system many times does not allow them to do that. It doesn't help them. It doesn't move them along. And a lot of the money is simply wasted there. And that's where we're losing a huge part of what could be a dominant and a very productive part of the American workforce.
Yes, and this is actually relevant even to our prescription drug abuse epidemic. As we're making progress on reducing the supply of substances that are available for abuse, people are not being referred to treatment so that we can also reduce the demand. So there is the public health and safety piece of it, but also the budgetary piece of it. Because again, if we get these people into treatment, we have an opportunity to cut that $560 billion worth of costs and really direct that money toward the social safety net programs for people who need them and strengthen those programs, frankly, because once they're more financially solvent, you can help more people as they need it.
What's the bigger problem here, the bigger roadblock? Is it the drug courts right now, when they look at something like this, all they're looking to do is drop the hammer quickly, put somebody behind bars? Or the fact that, simply stated, a lot of our technology in drug testing right now simply is not as advanced as it could be?
That's definitely an issue that needs to be addressed, and it won't be inexpensive to implement a drug testing program that relies on accurate accurate technology. Right now, the drug testing equipment and technology that are used actually has major problems with errors, and so it's possible for people to skirt the drug test and actually beat it just by going on the internet and buying a simple product to beat the drug test. It's also possible for there to be negative consequences for people who are subjected to erroneous tests. For example, in Pennsylvania, in 2010, a woman lost custody of her child for 5 days after the child was newly born because there was an erroneous drug test that identified a poppy seed bagel as an illicit drug. And so in order to implement the effective public health programs that really will make a difference, it's going to be necessary to invest in modern equipment and technology, which will be more expensive. But again, the ultimate cost savings will definitely come out when you look at reduced health costs, as well as reduced crime and greater productivity.
I've got about a minute left here. The president's got this one wrong, doesn't he?
Well, if you look at the drug court model, as you mentioned, we see that the therapeutic approaches to using this public system to get people help they need actually reduces recidivism and reduces costs. And so the president really should be looking at how we can use these programs to provide greater help to more people, right? And that's where I think, again, this is an error of people's misperceptions as well as an error of messaging, and people like Scott Walker can do better at both structuring the programs for their therapeutic purposes and messaging. But yes, the president does have it wrong. If you approach this type of drug testing effort from a therapeutic perspective, following the drug court model, which has proven to reduce costs and recidivism.
I smell politics in here, but gee, what a shocker when you see a Republican going up against a Democrat. I never would have thought that. Mike Barnes, thanks so much for the time and the effort. We'll stay up on the story. We appreciate your time. All right. Now, when 80 million people have their personal data spread around the world for all to see, what is the next logical step for those consumers who have had all their information stolen? Think of what Shakespeare once said. That'll give you a clue. We're back where we question everything right here on MidPoint.